Good morning. You're welcome to our today's class. Today we'll take a look at pharmaceutical calculations. So where did we stop last time? I think we are still discussing calculation of doses, right? We are still discussing calculation of doses. So we just spend a few minutes there, then we go over to review and see how far we can go. We stopped at doses based on the weight of the drug. And we discussed solid formulations, where we gave an example where we solved question that has to do with um, with 8 milligram drug X, 7 milligram drug S as the doses, where we have strength of one and the what 4 milligrams. Can you remember? So today we continue from we look at liquid formulations. We look at liquid formulations. We look at liquid formulations. For drugs in liquid formulation, of course, you are used to that. I believe you are still you entered the liquid dosage forms. Have you in your theory? Yeah. In your discussing theory, you studied liquid. Yeah, okay, good. So you are familiar with that now. So that one will not be an issue. Let me go straight to the point. So here in liquid formulation, as usual, you don't just consider the amount in terms of milligram of the drug. You also consider the volume of the entire what solution, the amount of the drug with respect to what the volume of the entire what solution. That's in that case you are talking about what concentration. Concentration. Now, so without wasting time, we have a question here. We look at that question, then we can now at least one question is okay. Yeah? We can now move on. We can move on. Come and write it on the board for us fast. Let's look at this question. Hello? Let's look at the question. The question says a prescription requires 360 milligram of paracetamol to be taken 4 times a day for 3 days. Supplied as pediatric paracetamol, 120 milligram per 5 ml suspension. Calculate the volume of paracetamol suspension to be supplied. If you look at the question, there are two parts of the question. The dose as prescribed by the what? By the physician. Am I communicating? Yes. Now followed by the what? The strength of the what? The medicine. Now this is the dose of the drug itself, paracetamol. You are to give what? 360 milligram of what? Paracetamol, which is the drug itself. But the dosage form, which is the suspension, has a concentration of what? 120 milligram in 5 ml. Am I communicating now? Yes, so you need to do what? Combine the two of them for you to know exactly the volume of the suspension that you will do what? That the patient needs to take in order to administer what? Deliver 360 what? Milligram. That's what the question is all about. That's what the question is all about. Solution. Now, if you are to put down the regimen, it's something like this: suspension, paracetamol, 360 watts milligram, 4 times what? Daily. They didn't mention whether it must be what? 6 hourly, but anyway, it's always good to maintain that time interval. But we just write what? QDS times what? 3 over what? 7. This, I told you before now that this is the best way to write it. But sometimes you see some prescription that will come like this. They just write paracetamol 360 milligram. They just write what? 5 ml. Is wrong. I think I've talked about it in this class. It's wrong because you don't even know. You don't even know the what. What if the one they have 5 ml of the medicine they have? What if that 5 ml cannot deliver what? 360 milligram? Am I concreting? So the person you don't even know the type of who will do what? Dispense that medication. You don't know. Some people don't care what they say 5 ml. They just say, okay, take 5 ml 4 times a day without asking the question, what is the amount of the active ingredient the physician intends to do what? Administer. So that's why I said that this is what? Wrong. You should specify the amount of the active ingredient. So here is what? 360 what? Milligram. So it's now left for you to know how many, as you are now counseling the patient, giving the patient, handing the medicine over to the patient, you are the one to tell the patient how many meals the patient needs to do what? Take. The position comes to you like this. You are the one to tell the patient, having done your calculation, determining how many meal of this one you have will deliver what? 360 milligram. It's now you that will now tell the patient how many meal to do what? Take. Simple. So here now, we have that the strength of the one they have is what? 120 milligram per what? 5 mil. So what it implies is that 5 mil of the dosage form they have will deliver what? 120 milligram. So how many mils we will deliver what? 360 milligram. We don't know, we call it X. So X here is now equal to what? 5 mil times what? 360 milligram over what? 120 milligram. If you cancel that, is what? This is 3. 15 what? Mil. So 15 mil of this medicine will deliver 360 milligram of what? Paracetamol as a drug. Does it make sense? Does it make sense? Have you now seen why I insist that this is wrong? In case tomorrow you see yourself, maybe when you go for IT or maybe when you start practicing, please always look out for this. Unless the physician is aware, comes to your pharmacy, maybe you are in hospital setting, or anyhow he's aware that the 5 mil can deliver the amount of the active ingredient he's looking for that the patient needs, unless the physician is aware. If not, please align with the physician to be specific on the milligram he wants, on the amount of active ingredient he intend giving to the patient. If not, you are making a very serious mistake. What if the active ingredient is a potent one? Am I communicating? So here now you simply say the question says calculate the volume of paracetamol suspension to be supplied. Now we are done with this, but we have not answered this question. I hope you know. I aware that we have not answered the question. This is just a dose of it. A dose is what? 15 mil. But a dose is what? 360 what? Milligram. Which is what? 15 mil. It's 15 mil that will deliver 360 milligram. But the question says the volume of paracetamol suspension to be supplied. So here now you have to consider the frequency of administration, at the same time the duration of what? Treatment. You compare the frequency of administration, how many times a day, then you now multiply by the duration of what? Treatments. So 4 times 12 is what? 12 doses. Am I completing? Yeah. You supply 12 doses. So 12 doses of this need to be what? Supplied. But they didn't ask what the doses. They want to be in volume. So you convert the doses to what? Volume. So doses, number of doses to be supplied is equal to 4 times what? 3. Am I computing? Which is equal to what? 12 what? Doses. But one dose is how many mil? Is what? 15 mil. Therefore 12 doses is now what? X. X is now equal to what? So we have 12 doses times 15 mil all over what? 1 dose. Those will cancel those. So we are left with what? 180, right? 180 mil. So therefore the volume of paracetamol suspension to be supplied is what? 180 mil. Therefore, the volume of suspension to be supplied is what? 180 mil. Any other question under this is just for you to play around volume and what? Milligram. Volume and what? Mil and milligram. Just sometimes you see a question that doesn't have the what, that may have just the mil. You are to do what? Convert it to what? Milligram. Simple. Am I communicating? Whether it is in injection form or whether it is in suspension form, it's still what? The solid in what? Liquid. Am I communicating? Is still the solid either dissolved or dispersed in what? Liquid. Whether it's dissolved or dispersed, all you need to know is that you just know the what? The amount, which is the dose to be given. Then at the same time, know the strength of the what? The medicine you have. Am I communicating? The strength of the medicine you have. So if you able to identify these two things, there's no question on this you cannot solve. Once you're able to identify which of them is the dose and which of them is the strength. As I said, the dose is what the patient needs, while the strength is what the manufacturer presented. So it's now you that will know how to manipulate the whole thing and be able to know how to do your calculation to get the amount of what the manufacturer presented that will deliver what the patient does what needs. Am I completing? That's what this is all about. And also knowing how to convert, do your intra-system conversion. Most of the things you see here may be from one metric system to what another, sometimes from milligram to what microgram. Am I correct? Once you know these conversion factors, you are good to go. That's why we did pharmaceutical what measurement. That's why we did metric system. Sometimes you may even see it as imperial system, that is common system. You start seeing measures, units in avoidable or apothecary. It's not left for you to move it to what metric, depend on what the questions want you to do what solve. Am I communicating? Good. Like there's this one here, this 7 point. Okay, come on. Come on, that is in fast. Fast. If I read these two at the same time, clean. Write the number one and write number two. Okay, let's look at these questions. Let's look at these questions. Question 1 says a prescription requires a dose of 200 milligram of paracetamol. What volume of paracetamol suspension, 250 milligram per 5 ml, would provide a dose of 200 milligram? This one, that there's nothing like a frequency of administration. They just want you to calculate number of ml that will deliver what? 200 milligram. It's simple now. It's simple. You already know. Is there anybody here that cannot solve this question? Raise your hand. If you cannot solve this number 1, raise your hand. Okay. Solution. All right. It says a prescription requires a dose of 200 milligram of paracetamol. The drug itself is what? 200 milligram. The amount of the drug that will take care of the patient's need is what? 200 milligram. But the pharmacy where the prescription is taken to, the one they have in your shelf is what? The strength is what? Per 5 ml. So if the one they have in their shelf is 250 in 5 ml, so how many ml will the patient take to deliver this what? 200 milligram? That's the question. So since we know that 5 ml will deliver what? 250 milligram. So how many ml will deliver what? 200 milligram. So X is now equal to what? 5 ml times what? 200 milligram over what? What's the answer? 40 ml. 4 ml, good. 4 ml. What type of what can we use to administer this? Oral what? Syringe, right? Good. 4 ml, we use what? Oral syringe. So 4 ml. So 4 ml of the paracetamol suspension would deliver what? Would deliver a dose of what? 200 milligram of what? Paracetamol. Good. It's simple. No matter how the question is twisted, so far you understand the one that is what? The amount of the drug, and the one that is what? The strength of the what? Product. You can manipulate it and get your what? Answer. Any question? No, this one doesn't require anything, because they just want you to know, to just calculate the amount, the volume that will deliver 1 ml. You talk of regimen. If there is a particular, let's say they ask you, they say that the patient will take so milligram, how many times a day for maybe 5 days, you start writing all those ones. In this one now, you don't just go straight and solve your what question. Am I communicating? Yes. Good. Question. That means that I should clean. Yes. Who said no? Oh, yeah, fast. All right. All right. The number 2 says a patient A patient requires an intramuscular injection, IM. A patient requires an intramuscular injection of 0.5 milligram adrenaline. Adrenaline is available as an injection containing 100 microgram per ml. How many mils of injection will supply the required dose? Okay. So here now, you know, what is it called? Adrenaline most times is administered as a start. Okay, starts here once. Am I communicating? So here now, if you want to write this, just simply write IM. If you watch now, they did not just write say injection. Injection is a dosage form, right? But they went down to the routes. Am I communicating? So please, always, if the route is indicated, start with the, don't just write injection, okay? Here now, what you write is what IM, not just injection. Am I completing? But they say that it's giving what intramuscular injection. So you should write what? We know it's injection, but preposition will specify IM. Am I completing? So here, what you have here is what IM what? Adrenaline. Adrenaline 0. What? 5 milligram what? Start. IM adrenaline 0.5 milligram start. Are we together? So now the question now you say that but the one that is available, this is the amount the physician wants the patient to receive. But it's not that for you to know the one you have in your shelf. The one you have in your whatever shelf or whatever what we are storing, whatever, is what? 100 microgram per ml. If you watch now, you've heard of something, milligram. But this one is now a microgram. Two of them are still metric what? Units, SI units. Am I completing? Yes. But you need to do what? There should be conversion. We have to find how many what mils. So now we know that from here now, what you have in the shelf says that what you have in the pharmacy says that 1 ml, but 1 ml is equal to what? 100 what? Microgram. So how many ml will deliver what? 0.5 microgram. Now, so which one are we going to move microgram to milligram? Which one is easier? Is it easier to move milligram to what? Microgram, right? So let's move milligram to what? Microgram. So this is what? 0.5 milligram. So if you move to microgram, what will it be? 0.5 times what?
1 milligram is 100.
Who is confused here? Nobody. What is the origin of your confusion? We move 100 microgram to what? You give me the answer. It's something. But the point is that you look for the one that will make it easier for you. Like here, if you start moving this now, you start dealing with 0.0000, which you may end up missing 1 0. By then you start having issues, okay? Am I competing? So to avoid that, so simply move this one. Just multiply this by what? 1,000 and get your answer and go straight, okay? Try in as much as the idea is not to show that you know what you are doing, but still get the answer. But look for the one that will you have less possibility of making mistakes. Am I look for the shorter route that will give you what you're looking for. This one is better to just multiply this by 1,000. Of course, even without writing anything on the board, Once you multiply this by 1,000, it will give you what? 500 micrograms straight. But this one now, you start moving it to 0.000, and at the end, you may get the answer, but just so here now, if you multiply this by 1,000, it will give you what? 500 micrograms. Is there anybody that's having issues with moving intra-system conversion in metric units? If you're having an issue there, you are, I don't know how to describe your issue. If you guys have any issue there, please, I don't know. Because we can't be going back there again. We can't be going front and back, front and back. So with this now, we can easily find our what? X, right? X is now equal to what? Over what? What's the answer? 5 mil. So 5 mils of the injection will supply the what? Required dose. Therefore, 5 mil of the what? Injection will supply the what? Required dose. So 5 mil of the injection will supply the what? Required dose. The questions are simple, they are not difficult questions. They are very, very simple questions to solve. On the issue of, okay. No, I think I've answered that question here. I answered it here. She asked that question and I answered it. It's not necessary. That one is not necessary because they just ask you straight question. And they're not like maybe they just want to know how many dose of it, how many meals that will give the dose. Am I communicating? You know that even if you write, are we together? If you write suspension paracetamol 20 milligram, what? Am I concluding now? It's wrong. Level what? Wrong. So you can't fit in. This is a wrong prescription. What of you? We know that paracetamol is taking what? 3 times or 4 times a day. So where is it? And what duration? Unlike this one, we know that adrenaline can be taking what? Start. Am I communicating? I don't mean this is injection paracetamol. Sometimes you may give like that, okay? Depending on what you want to do or achieve. Maybe you give and watch. But for this one, you don't need it. Unlike the other one. Are we together? Any other question? Is you crying? Are you sure? Are you with us? Are you sure? Okay, yo. You can go away. It's well. So we discuss. I will not dwell much on the doses. Remember the topic we did. Hey, what is it? Remember when we talk about factors that determine that affect the dose of what? Of drug, right? So with that now, I wouldn't waste my time to start talking about the doses in renal what? Impairment. I explained that in your AEM, right? It's straightforward. The doses in what? Renal impairment. When the patient has renal issues, kidney issues, how do you work around the doses? We discussed it now, right? Yes. Then there's no the wait now. And also, as you give, remember, I also talked about overdose. What do we mean by overdose? I told you that. Let me just use one example to explain this. Please, we have a lot of non-steroidal anti-inflammatory drugs. We have different classes of non-steroidal anti-inflammatory drugs, and all of them take care of what? Pain. Wonderful. But some of them take care of the pain at a very small milligram quantity. Am I communicating? Some we need larger what amount. Some of them are very, very what potent. That the therapeutic window is very, very what small. And some of them, and the if you give a patient, if you dispense or recommend or prescribe, as the case may be, depending on who you are, to a patient, and the drug is not giving you what you need, you don't need to do what start increasing the dose. Each of these drugs, their daily doses have been what established during their work when they were establishing their pharmacokinetic what profiles. Now, something like diclofenac sodium, being diclofenac sodium or diclofenac potassium, we know that it comes in the strength of what 50 milligram. Then some also come in strength of 100 milligram as control release what formulations. Am I completing? Now, the maximum daily dose of diclofenac is 150 milligram. The maximum daily dose is what 150 milligram. Then you now give your patient, let's say 100 milligram, 50 milligram to be taken twice daily, and the thing is not giving you the result you need. The highest you can give is to tell the patient to take what 50 milligram 3 times daily. If taking 50 milligram 3 times daily is not working, you may say, okay, let me give diclofenac the last chance. Okay, take this 100 milligram control release, take it in the morning, and gradually it will be releasing the drug for the whole day. If it's not working again, please look for another NSAID. If he establishes that there's no other serious underlying issues for the patient, move to another one. Do not say, okay, now you can take 200 milligram 3 times. You are killing the patient. Or take 100 milligram 2 times. You are killing the patient. You are destroying the patient's kidney. Gradually. That's why today there are a lot of kidney issues. The way we take NSAIDs in this country is alarming. The way we take NSAID is alarming. If I go to a hostel now, go to your bag, your luggage now, I will see them scattered. NSAIDs, pain relief drugs, scattered. Different brands. These things, they destroy the kidney, but you won't even know gradually. Yes. At the same time, and aside this one, other concussion you take, you don't even know what is inside. The package can give you drinking. You say it's a ready drink. You say it's or call it all sorts of names. So a lot of them. That's why today they are saying increase in what kidney issues is alarming. So what part am I making? If you give this and it's not working, shift to another one. There are a lot of them. That perhaps the company is there. Of course, you must have established that the patient doesn't have what anything that has to do with what ulcer. Am I communicating? Yes. There are many of them. So that's what we're talking about. You avoid what dose. Dose. The more you increase the dose of a drug, the more the adverse effect is what increasing. The more its side effect, adverse effect is what increasing. So that's the point I want us to note on this issue of the use in renal issue. Of course, you don't be told that if that drug is necessary for the patient and the patient has a renal issue, you do what? You adjust the dose. You adjust the dose, because the kidney is there to eliminate after the whole work. Drugs are xenobiotic, guys. I said it. Kidney is there to do what? Remove the one. But if the kidney it cannot carry the normal dose you have taken, they will accumulate and become what? Toxic. They will accumulate and become what? Toxic. Are we together? Yes, we are. So the last thing I want to talk about here is when it comes to dose in terms of units, dose is in terms of what unit. There's some question you will see, you start seeing things like units. Even in your pharmacy, there are some drugs you will not see milligram there. What you will see is what units. So we just see you, some IU. Even your insulin. Do you see milligram in your insulin? Who is opportune to handle insulin? See insulin injection. Is it milligram or IU? It's IU. Am I communicating? It's IU. At the same time, I think we have solved a question here. I think the first question we solved on ratio, proportion, where you are told that the patient require 40 IU, and the drug, the medicine is something, maybe I think 40 IU per meal or something. Can you remember? We solve a question like that. Also, there are some drugs, there are some medicine that comes as maybe some very vitamins now. You see them in something like vitamin E. You see them in you. Who is opportune to see vitamin E? It's in what you see is what you, not milligram. Am I communicating? Even vitamin A. Even what vitamin A. Then at the same time, there are also something like nystatin. Who has seen nystatin before? Nystatin, is it in milligram or unit? Now start, please. Now from now henceforth, please. Once you see any medicine, please look at it, study it now. I keep saying this. Not how others are seeing it. Like once you see any drug, look at it, look at the units, look at the amount of the drug inside, look at the concentration. These are the things. Look at active ingredients. There's no other way to know all these things. There's no magic. You can never stay one day and know them. If you have been able, if you are inquisitive, anything you see around you so far is medicine, look at it, study the drug inside, study the packaging, study everything about that. This won't take you more than 5 minutes to do that, because you know what they're looking out for. Am I communicating? So this is how to grow. This is how to do what? Develop your what? The library of what you know about what? Drug. So that if you see me here, I will calling all those things. There's no magic. It's just from time, even till today, I still learn. Once I see any medicine around me, I want to look at it, because it may be something new that I'll add to what I already know, what I already know. Now, another point I want to make is that something like who have seen this brand, this chymotrypsin and whatever. Yeah. Now, if you look at it, it's also in units. You will not, because you not pay attention. You just know it as chymotrypsin and go your way. You don't pay attention. Now go back there again where you saw it and pay attention. So these things are what in units. So now, most of these units, drugs like hormones, enzymes. Carbohydrate is enzyme. Hope you know. They are protein too. Hormones, enzymes. They come in what? Vitamins. Hormones, vitamins, enzymes. They come in what? Units. Am I communicating?
Yes, sir.
They come in what? Unit. And some antifungals. I think I mentioned nystatin here, right? Good. Other, what is it? You respond like somebody that is in international units. Yes. Okay, based on that now, come and write this question for me. For us, fast. If I write write 7.11 and 7.12. Also include 7.13 can enter, include it. See how all of them, how you can compress them to enter here. So we use this page to solve, okay? Take.
One, two, one, two, one.
Okay. Question 1 says, Nystatin, what class of drug does nystatin belong to? Good. Nystatin has a recommended oral dose for adults of 500,000 units every 6 hours for the treatment of candidiasis. A suspension containing 100,000 units per ml is available. What is the total daily dose of nystatin for an adult, and what quantity of suspension would be required for 5 days of treatment? So here now, this one would need a what regimen. Are we together?
Yes.
You need to put it down. So number 1, solution to number 1. Solution. Suspension nystatin 500,000 units is required every 6 hours. 500,000 watts units is required every 6 hours. Is what? What the right here? Q what? Q what? QCC. Good. Every 6 hours. Do you know why this QCC is preferred here? Because it's an anti-infective, right? It's an anti-infective, and that time is very, very important. That's why we can not just write QDS. That's why they specify 6 hours, every 6 hours. Are we together? Yes. So Q6H is better than just writing QDS. Are we together? Even though they are both talking about the same thing, but this one is specific now that you must maintain that what time interval. Now, times what? 5 over what? 7. Suspension nystatin 500,000 units Q6H times 5 over what? 7. Now, this is what the physician intends that the person should be given to be able to take care of what the candidiasis. What does the pharmacy have? Pharmacy have what? A suspension of nystatin that is what? 100,000 units per ml. So let's go. But what? 1 ml is equal to what?
100,000 units.
100,000 what? Units. So how many ml will be what?
500,000.
X is now equal to what? 1 ml times what?
500,000.
Over what? What's the answer?
5 million.
5 ml. So the answer is what?
5 million.
5 ml. So let go. It says what quantity? See, 2 questions are here. The first one says, what is the total daily dose of nystatin for an adult? You don't ask number of meals. Hello? You will not ask number of what meals. You will ask what is the total daily. In fact, that should even be the first thing said before this. Okay? Please, if there's any way you can do it, please note that should be the first thing before this one I solve now. We are asked what's the total daily dose. So a day is 500,000 units. Hope you know. Yeah. So a day is what? How many doses?
4.
I heard 3, 4. Which one?
4.
It's 4 doses. 4 doses. 4 what? Doses. Because you will take a dose is what? 500,000 units is a dose. So times 4. 4 times in a day. Because a week, a day is 24 hours. So if you divide 24 by 6 is what? 4 times. So 4 doses. So this one should come here. So we have total day doses what? 4 what? Doses per what? Per day. So now you are not asked, the next question ask us to determine the quantity of the suspension that will be required for what? 5 days. Now the quantity of the suspension, now you don't ask the quantity of the drug, the amount of drug, you ask quantity of the what? Suspension. And the quantity of suspension is a mere, because the consistency of the dosage form is liquid consistency. Am I completing? Yes. Because it is liquid consistency, the quantity should be in what? Mere. Had it been the consistency of the product is solid, it should be gram weight. Am I communicating? Yes. Remember I told you that the consistency of a product speaks volume on how the product will look like. Am I communicating? Yes. Good. Now we have what? The consistency is mere, is a liquid. So the quantity should be in what? Volume. And the volume here is what? Mere. So it should be in what? Mere. So for a day we have done the calculation now, and we have calculated that a dose is how many meals? 5 ml. How together? A dose is how many meals? 5 ml. So 4 doses a day is how many meals?
20 mil.
So 20 meals is required for a day. 5 days, 100 ml. Am I communicating?
Yes.
Quantity of the suspension per day is equal to what? 5 mil times what? For which is what? 20 mil. Therefore, quantity of the what?
For 5 days.
Suspension for 5 days is equal to what? 20 mil times what? 5, which is what? 100 mil. So 100 ml is required for 5 days, and that 5 days is the duration of the what? The treatment. That 5 days is the what? The duration of the what? Treatment. Is it clear?
Yes, sir.
It's clear. It's crystal clear. It's crystal clear. This number two question is simple. If you understood what we did in the first number 1 question, you can solve number 2 comfortably. I give you 1 minute to solve it. 1 minute, solve number 2 question. 1 minute, everybody. Number 2, everybody solve it. I want to see what you are solving. 1 minute. If you're not solving it, you are wrong. Everybody solve it. I want to see what you are doing. Are you aware you can solve this question with dimensional analysis? Are you aware? And get your answer straight. If you see there's a movement from male to units, a movement from male to drops. So you will set up two proportions. Are you aware? Good. What are you doing? Let me see what you're doing. You're not solving. Why? So what do you get? And 1 minute as yeah. That is very nice. I'll go back and Maya. I'll be first. So what's the answer? Who did that? Ada? Why are you shouting? You shouted now. What did you get? Precious, what's the answer? And you're laughing. You solve it now. As you made a mistake, same way I am. Mr. McKinney, what? Gift, what? Gift. What do you get? 6 drops. Good. You're not solving. Why? Cassie. You're not solving. Why? Cassie is not solving. 6 drops. Is that what you got? Do you want to? No wonder you're saying, I can't wait. Can you believe see a big una? And Kafia? What's name? Tell me now. What's name? What's name? African what? Hairstyle. Alright, so let's. If you have not solved this question by now, hey, good one. If by now you have not solved this question, it will take good one. There is trouble. There is fire on the mountain, and you seem not to be running. If by now you not gotten the answer, there is fire on the mountain, and you seem not to be what? Running. But you seem not to be what? Running. All right, so let's look at the. Okay. The question says a type of vitamin oral drops contain 5,000 units per ml of vitamin A. There are 40 drops per ml. How many drops will provide a child with 750 units of vitamin A? Okay, the dose is what? What's the dose? What is dose for this question? What is dose? You go far. The dose is what? 750 what? Unit. That's what you want to give to the what? The patient. The child needs what? 750 units of vitamin A. Good. Now, what of the strengths available? This is just a conversion factor. They want you to know how many meals, how many drops are in one meal. Simple. Am I communicating? Good. So the strength of the vitamin A available is what? 5,000 units per meal. But 40 drops is in one meal. But because I want you to know, to tell them how many drops that will now deliver 750 ml. If this you are to be OBJ question, you just go straight to the point. Once you know that there are 5,000 units in one meal and there are 40 drops in one meal, so just carry these 40 drops and put where? Here, straight. Am I communicating? That means that there are 5,000 units in 40 drops. So if there are 5,000 units in 40 drops, how many units will be? How many 750 units will be in how many drops? And you solve this question under 20 seconds and get the answer. That's why when some of you see your OBJ 100 question to be answered under 45 minutes, you'll be shocked. It's over easy just to know. Some people may go and start wasting their time. This one is now equal to this one in OBJ, and before you finish it, 2 minutes gone. Here, without even raising my pen, your pen, you can simply provide the answer straight without even touching your paper and your pen at all. You can easily provide the word answer. If there are 5,000 units in 40 drops, 750 units will be in what? How many what? Drop. $5,000, 40 drops, 750 x 40 drops, 40 drops times 750 over what? 5,000, and you get your answer. So let's go. These are the techniques you will use when you are answering what? OBJ MCQ questions. Am I completing? Please, these are the things that will help you to be fast in solving what? Questions. All right, so let's go. So here we know that one male contains what? No, let's 5,000 what? Unit of what? Of vitamin A, right?
Yes, sir.
But one male is how many drops?
40 drops.
40 what? Drops. Therefore, 40 drops
Is equal
to what? 5,000 what? Units. If 40 drops is 5,000 units, 750 units will now be equal to what? X. X is now equal to what? 40 drops times what? 750 units over what? 5,000 what? Units. This takes out of this. This takes out of this. What can go here? 5, 10, 5, 15. What else can go? 2, 5. 4 can go. 3. We have what? 6 drops. Therefore, 6 drops of what?
Vitamin A.
Vitamin A what? Good. Vitamin A oral drops.
You provide a child.
We provide
A child with 700.
a child with what?
750 units.
750 units of what?
Vitamin A.
Vitamin what?
A.
A. Very, very simple question. If at this point you couldn't, if you couldn't solve this question, if it's regularly equal, as far as this course is concerned, if it's regularly equal, and you need to do something about that. That is the reality on ground. You know that after every reality will always show its ugly face. I'm looking at you. Hope you know.
Yes, sir.
After every milizocha amachasia modern remote reality will always be stay quietly, calmly. I'm looking at you. You can never go because reality is what? Reality. So no matter how you feel, if you could not solve this question, there is fire on the mountain, and the area will start running the better. That's why I allowed you to solve it. If when I allow you to solve it, you try your best to see if you can solve it within that specific that time given. Shall we go to the next question?
Yes, sir.
Do you want to try it?
No, sir.
Do you want to try it?
No, sir.
Why are you running? Why are you running?
Yes.
You are here physically,
Yes.
but
Only you like it.
in terms of morale, you don't run. No morale to solve it. Wow, that's good. Hey, I thought you were solving number 3 questions, sir. And I'll sharpen my mouth to praise you. Only for me to realize that that's not what you are solving. All right, so let's look at this. There's something we need in this question. I want to mention one or two things before we can solve the question. But let me read the question out first. There are some conversion factors I want to point out here. So put it down as I call them out, please. Okay, the question says product A contains, this will contains, not contain. It contains. Product A contains 8 milligrams of vitamin A as retinol acetate. 8 milligrams of vitamin A as retinol acetate. What's another name for vitamin A? Retinol. The base is retinol, but the salt form is what? Retinol acetate. Now, product A contains 8 milligrams of vitamin A as retinol acetate. You know, drug can be in its base form. It can also be in its salt what form. Okay. And the 400 IU of calciferol. Vitamin what? Vitamin what? D. D, right? Good. Calciferol. And product B contains 2,500 IU of vitamin A and 10 microgram of vitamin D. What products contains the most vitamins? Please put this. I want to give you some correlation factors for questions like this. Put this in down, please. It is established. It is established that for vitamin A, it is established that for vitamin A, one IU is equivalent to 0.344 micrograms in bracket as retinyl acetate. Please watch this. I say that for vitamin A, please watch the specifics, please. For vitamin A, we say for all vitamins. For vitamin A, as retinyl, 1 IU is equivalent to 0.344 microgram. Please note that. Then vitamin D, ergocalciferol. For vitamin D, in bracket, ergocalciferol, 40 IU. 40 IU is equivalent to 1 microgram. Divide 1 by 0.344. What will it give you? Is it 40 dots? Is it 40 dots? 1 divided by 0.3.
2.9.
I like that answer. Hello, Ada. I like that your answer. I just said that to let you know that is not general. She converted it, thinking she thought it would give her 40 IU. That's why I mentioned that it's not a general thing. Okay?
Yes, sir.
That for vitamin D is different from that for what? Vitamin A. So for vitamin D, for vitamin A, 1 IU as retinyl acetate, 1 IU is 0.344 microgram. But for vitamin D, ergocalciferol, 40 IU is equal to what? 1 microgram. So that means for vitamin D, 1 IU is how many microgram?
1
See. I said for vitamin D, 40 IU is 1 microgram. I agree. Then 1 IU is what? Do it now. 0.0 what? Good. So with this now, let's solve this question. Hello? So with this now, let's solve this question. There are two products. There are two products here. Product A and product B. And each of these products, each of them has vitamin A and vitamin D, but in different quantities and different units. So they want us to check which of them has more vitamins. So we'll try, for us to do that, we move all the unit to one unit, to the same unit. That's when you can compare. You cannot be comparing IU and milligram and the intent to have a fair comparison. Am I communicating? Yes. So you move all of them to, is that you move all of them to IU or you move them to what? Microgram. For you to do what? Solve properly. Now, so let's go. So we have two products, right?
Yes, sir.
We have two products. We can prepare a table to make it faster for us. We have two products. We have product A
And product B.
So here should be products. Here should be what?
Product.
Product. And here should be what?
D, vitamin A, vitamin.
Vitamins. Okay.
Yes.
Amounts of what?
Vitamin.
Vitamin. Good. So here we have your what? A. We have your what? B. So here we have something like this. Something like this. Are we together?
Yes, sir.
Okay, this table, there's no space here. I need where I can sum up. No problem. Let me put this product here and put the amount here. Okay?
Yes,
So I can add up the. So let me put product here and the what?
put the
Amount.
there.
So here is what? Product.
Product.
Here is products. And here is what?
Amount of vitamin.
Amount of what? Vitamin. So we have here A, we have what? B. Sorry, here should just be simply, here it should be simply what? Vitamins, not amount. Here should simply what? Vitamins. While here should be what? Products and the amount of what? Vitamin. It's not this slash. It's and. Okay? It's not this slash, okay? Products slash and are not the same thing. No. Product and what? Amount of what? Vitamin they contain. Hope you know.
Yes, sir.
Vitamin content. Good. That's writing to write. Product and amount of vitamin what? Content. Here is the what? The vitamin itself. So here we have vitamin what? Vitamin A, and here is vitamin what?
B. Sorry.
We are good to go.
Yes, sir.
Now let's look at this now. For the product A contains what? 8 milligram of vitamin A. 8 milligram of what? Vitamin A. If you watch now, the unit that dominates more here is microgram, right?
Yes.
All together.
Yes.
The unit that dominates more here is microgram. So we can move other unit to what? Microgram and get our answer. Okay?
Yes, sir.
Yes. It's shorter to move others to what? Microgram than to move microgram to what? Others. Or trying to move everything to what? Milligrams. It's longer. Trying to move to IU. You get the same answer. You get the same. The product that have the highest number of the amount of vitamin will always be the same thing, but the process is there. It's much. So to avoid long process, we move to what?
Microgram.
What do you say? You say is it microgram or IU? Check where. They can both give it the same answer. No problem. Anyone you choose. Me, I want to move to what? IU. Me? No, you can be working on. It's a simple thing now. One person can be working on microgram, and another person can be working on what? Milligram. Let's see what we get. Who will work on microgram for us? Raise your hand. Good. Microgram, milligram, do good. Let's start. Others, look up. Let's move to what? IU. After we compare the one that has the highest what? Amount of what? Vitamin. Let's go. So we are moving to what? IU. While they are moving to what? Milligram and microgram respectively. So A here is 8 milligram of vitamin A. But remember, for vitamin A, one IU is what?
0.009.
For vitamin A, right? For vitamin A, one IU is what?
0.004.
Micro what? Gram. But we want it in milligram. Hope you know. So convert this microgram to milligram. Give you what? Times 1,000, right?
Yes, sir.
What's the answer?
344.
Go back again. Ada. So let us multiply separate, right? And get our answer. It's what? 3 what? 3 4 4 what?
Milligram.
Milligram. So 1 IU is 344 milligram. So that means 8 milligram will now be how many IU? 8 milligram will now be S. So what will it be? S is equal to what? 1 IU times 8 milligram over what? 344 milligram. What's the answer?
43 I.
Open the zero. 0 point what? 0 point what?
0.023.
0.0 what? 23 what? 23 IU, right?
Yes. Yes.
So here is what? 0.0 what? 23 what? IU. Then still under product A, what amount of vitamin D there? The same vitamin A, the same product A. Okay. We are moving microgram to milligram, right? Is that what we are doing? Wait. She called our attention to something. Please look up. We are moving from microgram to what? Milligram. We are not moving from milligram to what? Microgram. So we are moving from microgram to what? Milligram. It's right now. If it times 1,000,
1,000 micrograms goes to 1
1 milligram.
Then 0.3 equals
How many milligram?
0.0000.
Wait. We are moving from microgram to what? To milligram. Is that what we are doing? We are moving from. Wait. Calm down. We are moving from. Please. I hope everybody is following up.
Yes.
Good. We are moving from microgram to what? Milligram. And the 1,000 microgram is what? 1 milligram. Therefore, 0.344 microgram should be how many milligram? So we divide.
Yes.
Good. So if we divide, what's the answer?
0.003.
Just tell me how many zeros.
0.000.
3, 4 what? Thank you very much. Gift. So we are dividing by this, right? So if you divide, how many I will it give you? Divide by 0.000344. What's the answer? How many IU?
23255.81.
2 what?
23255.
Point what?
8.
8 what?
1.
1 what? IU. Thank you very much. So here is what? Here should be what? 2, 3 what? 2 what? 55 point what? 81 IU. Now what in IU for the same vitamin A? What's the amount of for the same product A? What's the amount of vitamin D? From the question, how many IU?
400.
Vitamin A contains 400 what IU? Thank you. 400 IU. What is the total of vitamins in this? Add 2 of them. What is the total of vitamin here in product A? Remember, the question says which of them has more vitamins. So that means we add up. This should give us 2, 3, 4. Sorry, 2, 3, 6, 5.81 IU. Is that what you got? 23655.81 IU. This is the amount. This is 23,655.81 IU of vitamins are in product what? A. Let's go to product B. Why confused? This do you understand this table at all? This is product A. All the two products contain vitamin A and vitamin D. This is product A. Vitamin A in product A is this. Vitamin D in product A is this. So total vitamin in product A is what? I don't know. Is it clear now? Huh? Is it clear now? Is it clear now? See the question. You see it here now. The question now. You were told that product A contains 8 milligram of vitamin A and 400 IU of vitamin what? D. Ego is vitamin what? B. Are you okay now? Good. Now let's move to vitamin what? Let's move to product what? B. So product B contains 2,500 IU of vitamin what? A. So write it here. Okay?
Yes, sir.
What?
2,500
IU.
IU.
Should I come and sit down? Please, I want our attention here. There's time for everything. There's time for everything. So, product B contains vitamin A 2,500 IU. See it here. The same product B contains vitamin D 10 microgram. So remember I am working on IU. So I'll move 10 microgram to what? IU. So remember from what I gave you 40 IU. Am I off the frame?
No, sir. Yes, you're not.
40 IU is equal to what?
1 microgram.
1 microgram. So therefore 10 microgram will now be what? X. X is now equal to what? 40 IU times what? 10 microgram over what? 1 microgram. Microgram cancel microgram. 10 IU times 40 is what? 400 IU. So vitamin D in products B is also what? 400 IU. Total is what? 2,900 IU. Now, product A contains 23,655.81 IU of vitamins. Product B contains 2,900 IU of vitamins. From what I solved, which product contains more? A contains more of what? Most vitamins, right? More vitamins, right? Good. I got A. What did you get in your own? 8,000 what?
8,107.6
For product A. B income.
7.55.
So B still has more vitamins. Your own income.
8.01 milligram for product A.
8.01 milligram. Well, B income.
0.89.
So A still has more what? Vitamins. So any unit you like, but it should be what? Uniform. Any unit you choose will give you answer, but it should be what? Uniform. That's so. If you watch now, everything here is in what? IU. That's when you can do a fair comparison. This cannot be a milligram. This in IU, and you say you are comparing, just like comparing a pharmacist with a pharmacy technician. You are not well. There's no basis for such what? Comparison. Am I communicating?
Yes.
Am I communicating? You come and say, hey, nah, this pharmacist is better than this pharmacy technician. Am I wrong?
It's true.
Hey, this pharmacist knows what he's doing. Hey, he's better. I prefer he's better than this pharmacist. Enter that wrong. You compare pharmacy technician with what? Pharmacy technician. And compare pharmacy with what? A pharmacist. Okay, you say, ah, nah, this pharmacist, this doctor is better than this pharmacist. Am I wrong? I like how he diagnoses disease. Ah, he's better than this pharmacist. He's better than wrong. What is he trained for? Am I getting? So the same way you cannot compare. Here you have microgram. Here you have you have milligram, and start saying that A has no. All of them must be in the same what unit. So the unit must be kept constant. That's the point I'm making. I think we are done with this. Any question here?
No.